And we've got some more breaking inputs that are just coming in, where in the last 24 hours, India has crossed the 50,000 mark in terms of the confirmed coronavirus infections. Overnight, more than 3,500 new cases were reported from across the country, with 89 deaths related to COVID-19. Now, India's mortality rate from the infection now stands at about 3.3%, and India is the 14th country in the world to have crossed the 50,000 mark in terms of the coronavirus infections. So India has now got more than 50,000 COVID-19 infections, and in the latest figures that have been put out by the government, it is being said that over 35,000 infections are still active, and a lot of effort is presently being carried out in order to try and isolate those hotspots where cases have been found. Remember, India has, in its third version of the lockdown, decided to go for a graded easing of restrictions to ensure that the infection remains restricted in just those hot zones, and so that the curve could be flattened. And to give us more insights into what is happening, we're joined in by our senior political affairs editor, Kartikeya Sharma, who's joining us over the phone line. Good morning to you, Kartikeya. So the very grim milestone of 50,000 infections has been crossed. What is the way forward for India?
A couple of things have become very, very evident in the Indian scenario. One, our doubling rate has deteriorated. That's a very troubling aspect. The second thing is that the cases have really gone up. And third, there are areas where maximum number of cases are being discovered. For example, Maharashtra, which is a big state in the western part of India, is accounting for more than 35% of the total mortality. Or, for example, the Ahmedabad municipality of the state of Gujarat, from where the Prime Minister Modi comes, Amit Shah, the Home Minister, comes, the situation has worsened to a limit that every shop in the city has been closed except milk and except medical supplies. 3-star hotels have been converted into COVID centers. And not only that, for the first time, fruit and the vegetable shops, which are even part of the general areas, have been shut down because yesterday's letter of the commissioner, the local chief lawmaker, suspected that there are roughly 2,000 suspected super spreaders in the city. So various states are giving various data, but as of now, because of increased testing and because of increased migration internally which is taking place to and fro, the numbers have spiked in India. And I think it should be a cause of great worry, because world over Saleh, the debate is very simple. How do we get back to normal? By saving lives or opening up economy? You know, it's like a devil's question. But the fact of the matter is that between the two and balancing the imperative lies the solution of dealing with this pandemic.
I think that's an important point that you've made. Now, this is the lockdown 3.0. You know, when the first lockdown was announced, the Prime Minister said, Jaan hai to jahan hai. The second lockdown was Jaan bhi or Jahan bhi. But with the number of cases that we have witnessed, Kartikeya, in the last 3 days, 10,000 cases in just the last 3 days, what will be the approach of the Indian government now?
So there are two things. You see, a lot of studies are being done and they have come out. One thing has become very, very clear, that the public spaces, for example, where people meet, like restaurants or squares in Europe, these places can become super spreaders. So I don't think that these places will be allowed to open, one. Secondly, what is expected to happen, Saleh, is that this curfew in India between 7 p.m. to 7 a.m. is going to continue. Third, the internal migration is being stopped in many states of India. For example, the big state of Karnataka in south of India, because in situ construction has been allowed. So I think there will be a streamlining of guidelines in India. There is a guideline implementation problem we are witnessing. For example, the big state of Uttar Pradesh wants to take back all the internal migrants, but the big state of South India, Karnataka, wants to retain them because they have opened up their construction industry. So these are the real issues where poor people are at the edge of the pandemic and they are suffering the most.
All right, we'll have to leave it there. Thank you very much indeed, Kartikeya Sharma, for joining us and getting us all those insights. Now, this, of course, remains the big challenge for the Indian government. There has been an easing of the lockdown measures in some places, but now the important thing is to ensure that the infection rate is kept under control. And also in terms of the figures that have come in, the daily number of infections have been on the rise. Yesterday, India recorded a jump of almost about 3,000 cases. The last 10,000 cases have been recorded in just the last 3 days. This week, India has also recorded its highest surge in terms of cases over a span of a week. It has also been India's deadliest week so far, with more than 576 deaths having been recorded in the last 4 days. Now, the graph on your screen shows the surge in terms of cases and deaths, while India has recorded its worst week since the pandemic broke out since early March. This, of course, has come at a time when India is in its third phase of the lockdown. Restrictions have started to be eased, but this will have to be done in a graded manner. Different states have performed in a different way. The number of infections that have been witnessed in different cities is also different, and therefore the approach will be that one size fits all will not work, and different districts, states and taluk level will have to be identified for the government to proceed from here.